When it comes to stroke, there are subtle but predictable symptoms. For example, you may have difficulty speaking or weakness on one side of your body, but there's no way to predict how a patient will respond to treatment. Well, an experimental blood test could change that. The Fox Medical team's Beth Galvin is here now to talk about this research, which is happening right here in Atlanta.
Yes, Karen, researchers at Morehouse School of Medicine have been working on this project for about 7 years now. They're studying gene patterns in our blood, and they're hoping to one day help stroke survivors and their families get a faster diagnosis and a better idea of what to expect.
Every year in this country, 750,000 people have a stroke, and with better treatments, more are surviving. But strokes can be hard to diagnose, and it's impossible to predict how a patient will respond to treatment.
And this is what patients' families ask me all the time. Well, okay, you told us the bad news. Our relative had a stroke. Now tell us, how are they going to do?
But Dr. Roger Simon, a professor of neuroscience and medicine at Morehouse School of Medicine, believes our blood may hold some important answers about stroke, specifically our white blood cells, which are the scouts of the body's immune system.
And they're looking around the body just to making sure that everything is okay. And occasionally, everything's not okay. And when things are not okay, those blood cells respond.
Dr. Simon and his research partner collected blood samples from 28 stroke patients being treated at Grady Hospital's Marcus Stroke Center, then compared them to samples from 28 patients who hadn't had a stroke. And by looking at specific genetic patterns in their white blood cells, the researchers were able to determine with at least 90% accuracy which patients had had a stroke and what their short-term prognosis would be.
And with 500,000 pieces of information, not rolling the dice for 1 to 12, we can tell whether you've had a stroke and if you've had a stroke, how well you're going to do.
This research is still in the very early stages, but Dr. Simon hopes it will one day take some of the mystery out of what to expect when stroke hits.
And this was a small study, and all the patients were African American because they are at higher risk for stroke. And Dr. Simon hopes to one day be able to build on these findings and expand this research to look at gene expression patterns in other groups. Karen?
But I heard you say a stroke is very hard to determine. The symptoms are so subtle. It's not like a heart attack where, boom, there's a pain, you know what's going on.
Yeah, you don't have that classic chest pain. Sometimes you don't have any pain at all. So really important to kind of get an idea and read up on the stroke warning signs, like the feeling off balance, the weakness on one side of the body, the drooping, face on one side, because a lot of times we may not realize, because we're not in pain, that we're having a stroke, but you may realize and be able to spot the signs and call 911. Stroke is a medical emergency and you have to respond quickly.
Good advice, Beth. Thank you for that.